Welcome to this Bone Matters programme on pain. We'll be talking about pain caused by broken bones, particularly by broken bones in the spine. Now, we know that some people will have mild or even no pain with spinal fractures and they manage it well. But for others, pain is severe and at the time of fracture and takes a long time to get better. And it can feel overwhelming. This Bone Matters is for you if you need some help. We'll cover how to get the most from your pain relieving medications to manage pain better and common fears or worries that some people have around taking pain medicines. At the end, we'll cover some other hints and tips on non-drug approaches to managing pain. I'm Viv and I'm one of the specialist nurses here at the Royal Osteoporosis Society and I work on the helpline. I'm joined by my colleague Niki. Niki, would you like to introduce yourself?
Yes, thanks, Viv. I'm Niki. I'm also a specialist nurse in osteoporosis and I work with Viv on the helpline.
Thanks. So you may hear your doctor use words like pain relieving medicines, pain relief, painkiller and analgesics. So just to let you know, they all mean the same thing. They're all medications which help to reduce pain. This can be something you buy yourself, such as paracetamol, or something stronger from the GP, such as codeine or morphine. Now, Niki, we often hear on the helpline from people having problems coping with pain. They simply don't know what to do, or they have tried taking pain relieving medications that don't seem to work.
Yes, that's true, Viv. It may be that they haven't yet found the right dose of pain relieving medication that's working for them, but sometimes the problem is more to do with how they're taking them. They may not be taking the pain medicines in the way that works best at reducing strong or severe pain. Pain from a recent broken bone is often there most of the time, and when it is, it's usually worthwhile considering taking a pain medication at regular intervals throughout the day and a dose at night time if needed. On the helpline, we often hear that people try to do without pain medications for as long as possible and take a dose only when the pain has become unbearable. Some are worried about having side effects like constipation, or that they might become reliant or addicted to the medications. But we'll be talking about this later and how these problems can be avoided. But by waiting to take pain relief only when the pain is at its worst, the medication has a much bigger job to do, and it may not relieve it very well. It may stop them from sleeping at night, or they're unable to move out of their bed or chair, and this can slow up their recovery. Instead, pain that's there most of the time is often better relieved by taking a pain medication more regularly at fixed intervals. So, for example, if a doctor has prescribed a pain medication to be taken 4 times a day at a specific dose, this is usually worth doing. Pain is stopped from becoming as severe and it's gradually reduced to a lower level.
Niki, is the goal of regular pain relief to be pain-free?
Well, the first goal of pain relief, Viv, is to allow you to rest and sleep more comfortably. Pain in itself can make you feel very tired. If on top of that you're not sleeping well because of pain, the tiredness can make the pain feel even worse. The second goal is that pain is reduced enough so that you can manage to stand up and move about. It's still likely to hurt, but it's not bad enough that it stops you getting up and moving.
Some people worry, though, that the pain they get with moving around is a sign of further damage.
Moving may cause some pain, but don't worry, it does not mean that you're causing more damage. In fact, not moving can cause joints and muscles to stiffen up, which makes the pain worse. So it's important to move and take short walks around your home every hour or so. You can also use these times to go to the toilet or get a drink. Moving may hurt, but you're not causing any damage by moving.
But how do people know if they're doing something that will make the broken bone worse? Will pain relieving medicines stop you being aware of this?
No, that doesn't happen. Pain medications will not take pain away completely, leaving you numb or unaware if you're putting too much stress and strain on the broken bone. They reduce your pain, but they're very unlikely to remove all of your pain. Viv, I mentioned earlier that there are reasons why some people don't take their medications to relieve their pain, and that some are worried about becoming addicted to them.
Yes, we encourage people not to worry about this. If you have been taking a stronger pain relieving medication, such as codeine or morphine, for a while, don't be tempted to stop them suddenly because you may get sudden symptoms of sudden withdrawal, such as muscle aches, feeling anxious, or feeling a bit sick. This is different to addiction, but may be a physical reaction to stopping them suddenly. You will be able to stop them altogether when you're ready, but remember to just do it gradually and with your GP's help. They may suggest gradually reducing the dose or the number of times a day you take it, or changing over to something less strong.
What about side effects of pain medications? Constipation often makes people wary of taking them.
Yes, some side effects you can prevent, such as constipation, so this shouldn't stop you taking pain medications, but we know it can be a real worry for some people. When you have a broken bone, there are lots of things that can increase the likelihood of you getting constipated. Pain can cause constipation, and not moving around as you'd normally do can also cause constipation. You may also not be eating well and not drinking as you would normally, and these can lead to constipation. But there are things you can do to prevent it. Try making sure you're drinking plenty of water, and try having some high fiber foods in your diets, like cereals, like porridge oats, wholemeal bread. Plenty of fresh fruit and vegetables can help. And as I said at the beginning, constipation is best prevented, especially when you are in pain, because you don't want to push hard when you're on the toilet. So if you are on a pain relieving medication such as codeine or morphine, ask your doctor or the pharmacist what you can take to prevent constipation. Your doctor may prescribe a mild laxative, or you can buy these at the chemist too. Also, if your poo does get a bit loose, reduce the laxatives so you take them less frequently, and you'll soon return to normal.
Well, people sometimes feel sick and queasy. What can be done about that, Viv?
So some people may feel sick when they first start a new pain relieving medicine, but usually this doesn't last long. It tends to be temporary. If you're having these problems, you can try things like herbal teas containing ginger or peppermint, or sipping a fizzy drink like sparkling water may help. If it doesn't get better, do go back to your doctor and they might suggest an alternative pain reliever or perhaps a medicine that you can take to help.
And are there any other problems some people might experience?
So sometimes strong pain medicines can make people feel dizzy or sleepy, and if this happens, do let your doctor know. They may lower the dose or change the medicine you've been given. So, Nikki, we know that pain relieving medicines taken regularly can often work better at relieving pain that's there most of the time. Is there anything else that can help?
Yes, there is. It's worthwhile thinking about the times of day when you might need to take pain relief most. For example, on the helpline, we often hear that people take their first dose of pain medication with their breakfast, and at that point, they're already in a lot of pain. Just getting up out of bed can be tough when your body has been largely still for much of the night, and when muscles and joints are stiff and painful to move. Then there's going to the toilet, getting washed or showered, getting dressed, and getting breakfast, all without something to lessen the pain. So the pain medication taken at breakfast time has a much bigger job to do, and you may feel unable to move until the pain is beginning to reduce, and that may mean half your day is gone. But there is another way of doing it. Try taking your first dose of pain medication around an hour before you get up in the morning. It will have had time to get into your system to deal with what can be the busiest part of your day. The only exception to this is when taking an anti-inflammatory pain medication like ibuprofen. These can cause indigestion on an empty stomach. So if you take one of these, do take it with your breakfast. But other pain relieving medications can be taken on an empty stomach, such as morphine type tablets or liquids and paracetamol.
But Nikki, what if someone has tried all of this and it's still not helping them sleep, or they're finding it very difficult to move?
Yeah, it's not always possible for the doctor to know which pain medication or which dose you might need to relieve the pain you have. We're all different and we can all respond a little differently to a medication. So it's usual for the doctor to start off by prescribing something milder or at a lower dose. This helps to avoid giving you more than you might need, possibly causing side effects such as feeling sleepy. But if that medication or dose isn't helping to relieve your pain enough, remember this is a starting point. just let your GP know. Doctors follow a stepped approach to pain medications. The plan will be to go up a step with a dose or change to a stronger pain medication until the right one has been found. So don't lose heart if the pain medication you've been prescribed isn't relieving the pain enough. Check that you're taking the dose recommended on the packaging and up to the number of times it says to take it. If you are, and if it's not helping you enough, let the doctor know. Well, hopefully we've reassured you that there are ways that help to get pain under better control. But Viv, what do people do if they experience pain between their regular doses of pain medication?
When the pain or broken bone is new, doctors often prescribe a pain relieving medicine that can be taken when needed, so between the fixed doses of your main pain relievers. For instance, if your doctor's prescribed morphine tablets, ask what you can take when needed, and occasionally paracetamol or an anti-inflammatory pain medicine like ibuprofen is enough. Or the doctor may prescribe something stronger, such as a morphine liquid that you can take, say a teaspoon at a time. If you don't have anything like that, ask your GP if there's something you can take as and when required between the doses of your main pain relievers.
And sometimes something has caused a pain flare-up, which is when pain has increased temporarily. What can people do when they have pain flare-ups, Viv?
So listen to your body. The goal is that you don't get pain flare-ups which wipe you out for a few days. So as you heal, flare-ups will happen, but you will recover and you can learn from them. Learn from why it's happened, what caused it, so you can avoid these flare-ups. And there are things you can do to help. So when having a pain flare-up, rest, maybe use additional pain medicines we just talked about, or use other complementary non-medicine techniques to help, which we'll talk about in a minute. If you do have a flare-up, it's best not to go to bed for the whole day if you can avoid it. If it's the only place you're comfortable, perhaps set an alarm to make sure you have time to rest and let the pain settle, but try not to let it be too long. But Niki, people tell us that when their pain is getting better, they start doing a bit more, but then the pain may get worse again. What can be done about that?
Yes, you're right, Viv. As healing of the fracture has taken place, it's natural to find that the pain is less and you're beginning to feel better. You may then be thinking it's time to gradually reduce your pain medications. And it may be. It's good to start using non-medicine pain-relieving techniques and strategies more, such as heat or pacing your activities in the day, which Viv will explain about next. But what's worth remembering is that you're likely to increase what you're doing at this stage in your recovery. You might be doing exercises a physiotherapist has recommended, or some exercises you've seen on our website, or you're gradually increasing the length of your walks or doing more about the house. It's good to start getting back to normality if it's done gradually. But by doing so, you may find your pain becomes worse again. Don't worry, this is usual. So take this into account if you're reducing your pain relieving medications. Talk this through with a GP so that you're not cutting them back too much too early at this stage, making it hard for you to do the exercises and activities that all help in your recovery. As you do more, the pain will naturally ease and get better, allowing you to continue gradually reducing your pain relieving medications. Viv, I've mentioned that there are non-medicine techniques and strategies that can help to reduce pain. Can you explain this a bit more?
Yes, certainly. Well, as we just said, spinal bones do heal, but their new shape affects other things like our muscles. So gentle stretching exercises can actually help keep the muscles moving. When you're not moving, muscles can get tight and this can make pain worse. This is one of the reasons pain is sometimes worse in the morning when you've been in bed all night. There is more information about these exercises for back pain on our website, where there is a film and a fact sheet, which you'll find in the links below.
What about warmth or heat? How does that help?
We often speak to people on the helpline who find warmth from a hot water bottle or heat pad really helpful. The warmth helps tight muscles relax, as well as reducing pain by blocking pain signals to the brain.
And are there any other tips for people when they're starting to do a bit more on their road to recovery, Viv?
Yes, of course. There are things you can do, simple things like pacing yourself, prioritizing, and planning ahead. Maybe we'll call them the 3 Ps. So, pacing yourself allows you to do a bit, then rest a bit, then do a bit more, which helps prevent pain from coming on or getting worse. So, with gardening or housework or even getting ready in the morning, try breaking it down into chunks. This is better than ploughing on through pain until you find you can't do any more or the pain is severe. So the next P's are prioritizing and planning ahead. Think to yourself, what's the most important thing I want to do today or this morning? So prioritize this. Plan it into your day or around your pain relieving medicines. So if this is going for a walk or doing your exercises, maybe do this when you've had your pain relieving medication, not when they've worn off. So and plan to rest afterwards. And if you find standing for long periods of time painful, think, can you sit or use a perching stool to do the activity? We have some useful links to equipment like that might be helpful in another talk in our Bone Matters series, which we'll put the links to below on the Living with Osteoporosis page of our website. And distraction can be a great way of reducing pain. So watching the TV or a movie, listening to relaxation or mindfulness tape or podcast, talk to a friend or family member on the phone, knitting, reading, a hobby, anything that might take your mind off your pain.
And in the longer term, what might people expect in the next few months as they're further along their road to recovery?
Yes. So remember that recovery is not always a straight line, and having good or bad times or good or bad days can be a natural part of that recovery. You're likely to find that you gradually feel better and in less pain for part of the day and then most of the day. On a good day, you may decide to do a little more. As we said, catch up on housework or gardening you've not been able to do, or go for a longer walk. And you may feel your pain is worse the following day, for example. But that's all part of a gradual recovery. You just think you may have overdone it, so be kind to yourself. But gradually, you'll be able to stop your regular pain relieving medications altogether and instead use other techniques more to avoid or lessen pain, such as warmth, pacing, and distraction, which we talked about earlier. But make sure you have a way of dealing with flare ups of pain. That this can be taking simple pain relieving medications such as paracetamol or ibuprofen, and some people may need something stronger, such as codeine, to take occasionally. In time, you may be able to move away from taking a pain relieving medication with every pain flare up. This is as you come to recognise what causes them and what works for you to prevent the pain coming on, or avoiding the pain from escalating by stopping what you're doing early on in the pain flare up. This ongoing or persistent pain is often better managed using these non medicine strategies, but there may be some occasions when a dose of your pain medication is needed as well. So, well, Niki, thank you for joining me today. And for those out there watching, we hope you've picked up some useful tips. There's a lot more information on our website and in our fact sheets on pain relieving medicines, as well as non-drug ways that people may find helpful. We also have more information about other ways that broken bones may affect you and ways to help in our other Bone Matters sessions. Thank you and goodbye for now.
Goodbye.